ready? Yep, okay. Hi Martha, how you doing today? It seems like you're in a lot of pain since you haven't been able to go to the bathroom since your surgery. When we looked at the bladder scan, it looked like you had about 800 cc's in there, which is pretty uncomfortable. So the doctor did order to place a catheter today. Hand sanitizer. So I'm going to first start by assessing your area. Alright, so I'm going to start by washing off your labia majora. Labia majora. Labia minora. Labia minora. Great. Place you in a lithotomy position, so your knees are up and your hips are nice and spread out for me. Open up my kit. I would have asked you for your patient identifiers before we got started, so I can do that now. I'm going to look at your wristband. And then can I have you say your name and date of birth? Thank you. Alright, I'm going to have Katie come help me.
Okay. Alopecia.
Yep, 1, 2, 3, good. Sliding under, out. Perfect. And down. Alright. From here on out, we'll be in a sterile field. Going to place this drape over your perineal area. I technically wouldn't do this because it is a sterile field. I'm going to lay this flat. Place my lube. Opening up my betadine. Pouring it into the container. Getting my saline. Placing it onto the catheter. Or unsheathing it. my cotton balls would already be soaked with betadine. My hand is going to open and stay on the vagina area. I'm going to wipe the labia majora, labia minora, and labia minora. From here, I'm going to gather my catheter. That is already lubricated, and insert into the urethra. And I insert until I get a urine return, or about 3 to 5 inches. From here, I hold the catheter and inflate my balloon with 10 cc's of saline solution. I will pull out until I feel resistance. I'll tape the catheter to the patient's leg so that there's enough slack. Looks like the tape did not hold, which it would have had I had a normal lock. Placing the catheter below the patient so that urine doesn't backflow. Another piece of tape. Clean up my area. From here, I'm going to wipe off the leftover betadine residue around the catheter. And I'm going to wait 15 minutes before I get a urine return for a urine sample, which that time has passed. I'm going to place the label on the outside of the lid. Make sure my patient is comfortable with the bed at the lowest position, call light in hand. And now a couple of days have passed and we're going to discontinue the catheter. Hi Mary, it's Amy. I'm your student nurse again today. We're going to discontinue your catheter. I'm sure you're glad to hear that. So I'm going to place your legs in that position again. I'm going to untape. I'm going to place this underneath you, just in case we get a few dribbles. Alright, so I've untaped my catheter. I'm going to deflate the balloon. And it was a 10 cc balloon, so that's how much I'm going to initially pull out. I'm going to place the back in and see if I pull anything else out. I don't, it's just air, so the balloon is completely deflated. From here, I'm going to slowly pull out the catheter. Good. Into my glove. I'm throwing everything away. I'm going to re-glove and assess if the patient needs peri-cares. All right, Mary, I'm going to wash down there, okay? Outer. The other labia majora. And her labia minora. And the other. Great. All right, Mary. If you need anything else from me, let me know. Here's your call light. Your bed rails are up and your bed is in the lowest position, okay?